Hello, my name is Mercy
Hi.
John. I'm the nurse practitioner with UT Arlington. I'll be taking care of you today, okay?
Okay, thank you.
Have your seats.
Okay, thank you.
Can you verify your name and your date of birth?
My name is Abby John and my date of birth is May 2073.
Mr. Abby, how do you like your name to be called?
You can call me Abby.
Let me wash them. Whatever we discuss today will be confidential and will not be shared by anyone who is not directly
Okay.
involved in your care.
Okay.
Mr. Abby, what brings you in today?
I have a stomach pain.
How long did you have this?
Yesterday onwards,
What were you doing when the pain started? Were you eating or were you resting after work?
after food,
Okay. Where is the location of the pain?
right side of my stomach.
Can you describe the nature of the pain? Is it sharp or throbbing? Is it colicky type pain or is it aching?
It's kind of sharp.
Okay. How would you rate the pain on a scale of 0 to 10? If 0 is the least and 10 is the maximum, what is the level of the pain?
Actually, I had a, I don't know, today morning, so it's kind of 4 out of 10 right now. Otherwise, it would have a 8 out of 10.
Okay, what stimulates the pain? Is the food making it worse, or is the position like lying down or sitting up making it worse?
Food,
What relieves the pain? Is the medication or any food relieves the pain?
medication, Tylenol.
Do you have any associated symptoms like nausea, vomiting,
No.
any diarrhea?
Yes, I had diarrhea yesterday 3 times.
Okay, is it watery or has
Yes,
solid?
watery.
Okay. Do you have any constipation?
No.
Any fever?
Yes, I have fever yesterday.
Okay, any chills?
No.
Is the abdominal pain radiating anywhere?
No.
Any burning urination?
No.
Any urgency in urination?
No.
Now, regarding the medications that you take, do you take any over-the-counter medicines?
Yes, I took a Tylenol,
Okay, how much?
1000 milligram, 6 hours whenever I need.
Okay. Do you take any prescription medication?
Yes, I took BP medication and thyroid medications.
Can you tell the name of the blood pressure medicine?
Trimerans, hydrocors, there's no say.
What is the dose?
37.5 bar 25.
How often?
Once a day.
Okay. And what's the name of the thyroid medicine?
Synthroid.
What's the dose?
25 microgram once a day.
Okay. Do you take any kind of herbal medicine?
No.
Now, regarding the allergies, are you allergic to any medications?
No.
Are you allergic to any kind of food?
No.
Any environmental allergies like seasonal allergies?
Yes.
Okay, what symptoms do you have?
Sneezing and runny nose during the winter time.
During the flu season?
Flu season,
Do you
yes.
take any medicines for that?
No.
Okay, what contraceptive device do you use?
Condom.
Okay, now talking about your immunization, have you been immunized for MMR?
Yes, yes.
Do you remember the date?
October 9, 2011.
Okay, have you been immunized for tetanus?
No.
For pertussis?
No.
Have you been immunized for polio?
No.
Have you been immunized for hepatitis A?
No.
Have you been immunized for hepatitis B?
Yes, three doses.
Oh, you took 3 doses?
Yes.
Can you tell me the dates, please?
4/9/2012, that's the first dose.
Uh-huh.
5/9/2012, that's the second dose.
Uh-huh.
And third dose was 10/9/2012.
Okay. Have you taken the flu shot?
Yes, every season.
You take every flu
Yes.
season. Pneumonia shot?
No.
Have you taken the chicken pox?
No.
You had chicken pox?
Yes, I had chicken pox when
When
I
you were
was small.
small?
Actually.
Okay. What about the meningococcal vaccination?
No.
Smallpox vaccination?
No.
TB skin test?
Yeah, I had done 2 years back.
Okay, what was the result?
It was negative.
Have you taken the HPV vaccine?
No.
Okay, when was your last physical exam done?
1 year back.
Okay, let's review your past medical history. Overall, what's your general or what's your mental health?
I'm okay.
Okay. Speaking about your childhood illness, Did you have any kind of major childhood illness like measles,
No.
mumps,
No.
rubella,
No.
pertussis,
No.
chickenpox?
The chicken was when I was small.
Small, okay. Any rheumatic fever,
No.
diphtheria,
No.
polio,
No.
asthma?
No.
Okay, and did you have any history of cancer,
No.
coronary artery disease,
No.
high blood pressure?
Yes. Last 2 years onwards.
Oh, since 2 years you're having blood
Yes.
pressure. Okay, any thyroid disease?
Last 5 years onwards.
You're having thyroid disease.
Yes.
Diabetes mellitus,
No.
sexually transmitted illness,
No.
TB,
No.
hepatitis,
No.
COPD.
No.
Did you get hospitalized in the past?
Yes. I removed my tonsils.
Oh, okay. Any kind of surgeries in the past?
Yes. I had a tonsils removed in the year 2000.
Okay. Did you have any kind of serious injuries like fractures,
No.
spinal injury,
No.
liver laceration?
No.
Do you have any kind of disability like difficulty walking,
No.
difficulty in carrying out activities of daily living?
No.
Did you ever have any type of transfusion like blood,
No.
albumin,
No.
platelet transfusion?
No.
Okay, now talking about a family history, does your mother have any major health condition or genetic disorder?
No.
How old is your mother?
68 years old.
Does your father have any major health condition, genetic disorder?
He have high blood pressure and diabetics.
Okay, how old is your father?
73 years old.
Okay, does any of your brother or sisters have any major health condition, or genetic disorder?
Yes, my older brother have BP.
How old is he?
45 years old.
Now, talking about your maternal grandparents, did they have any major health condition or genetic disorders?
Yeah, my grandfather he had a BP.
Is he still alive or
No,
died?
he died when he was 85 years old.
Okay, what about your grandmother?
Grandma, she had a BP, and she passed away when she was 83 years old.
Okay, talking about your paternal grandparents, did they have any major health condition or genetic disorder?
Yes, my grandfather had BP, diabetics, and vision problem also.
Is he still alive or?
No, he passed away when he was 81 years old.
What about your grandmother?
Yeah, she had diabetics, and she passed away 82 years old when she was.
Okay. Talking about the social or personal history, do you smoke?
No.
Do you use any smokeless tobacco?
No.
Do you drink alcohol?
No.
Do you use any illicit drugs like marijuana,
No.
cocaine,
No.
heroin?
No.
Any use any methods like smoking the drugs or
No.
sharing needles?
No.
In your occupation, are you exposed to any kind of poisonous chemicals, asbestos?
No.
What are your hobbies and your recreational activities?
I like to do interior designing, gardening, and watching TV.
Okay. Do you live in a house, apartment, or shelter?
I live in a house.
How many of you live in that house?
My wife and 3 kids.
Okay. Do you have any kind of pets?
No.
Okay. Have you been in the military service?
No.
Okay. Do you have any kind? Do you feel that you're weak or fatigued?
Yeah, yesterday onwards I kind of weak.
Weak. Do you have any fever?
Yes, yesterday I had a fever.
Okay. Is it low? Did you check the
Yeah,
fever?
yes, 99.
Okay. Any weight loss or weight gain?
No.
Loss of appetite?
No.
Do you have any kind of skin rash, itching, pigmentation?
No.
Abnormal skin or hair growth?
No.
Do you have any frequent or unusual headache?
No.
Blurry vision?
No.
Hearing loss?
No.
Pain in the ear?
No.
Sore throat?
No.
Nosebleed?
No.
Do you have any kind of pain in the breast, tenderness,
No.
discharge?
No.
Do you have any cough, sputum production?
No.
Shortness of breath?
No.
Do you have any chest pain?
No.
Swelling in your legs?
No.
Blood pressure?
Yes.
Okay, how long have you had the job?
Last 2 years onwards.
Any previous heart attack?
No.
Do you have any, are you intolerant to any class of foods? Like, do you have nausea, vomiting?
No.
Are you having diarrhea?
I died yesterday onwards. I have
Okay, like how many times?
3 times a day.
And is it watery or?
It's watery.
Okay. Do you have the blood in the stools?
No,
Jaundice?
no,
Do you have any painful urination?
no,
Blood in the urine?
no,
Frequency and urgency in urination? Okay. Any scrotal swelling?
no,
Any testicular pain?
no,
Do you have any neck pain or joint stiffness?
No.
Any swelling around joints?
no,
Do you have any dizziness?
No.
Or seizure activity?
No.
Loss of consciousness?
no,
Do you notice any? Do you have any lymph node enlargement or
no,
tenderness in any part of your body?
no,
Do you have a low blood count?
no,
Do you get easily bruised?
No.
Any gum bleeding?
No.
Do you have any thyroid disease?
Yes, I have last 5 years onwards thyroid disease.
Okay. Are you heat or cold intolerant?
No,
Any unexplained weight loss?
no,
Diabetes?
No.
Increased thirst?
no,
Increased appetite?
no,
Do you have any depression?
no,
Suicidal thoughts?
no,
Suicidal ideation?
No.
Any anxiety?
No.
Any agitation?
No.
Any tension?
No.
Okay.